Gibson, and I want to talk to you tonight about hammer toes. One of the other deformities that we commonly will see in the digits, you can see pretty well on x-ray and so forth, is a contracture or curving of the toes we call hammer toes. This usually happens to toes 2, 3, 4, and 5, 2 being the most common. And if you count them, you're going to count from the big toe is 1, and 2 is the toe right next to it, and 5 is the little toe or the pinky toe. So the hammer toes are basically a contracture of the digit. It can happen at any one of the joints. It can happen at the very tip, which they call a mallet toe. It can happen at the further back, which they call a hammer toe, or it can happen at both at the same time, which they call it, they say is a claw toe. You can also have contracture at the metatarsal phalangeal joint, so you can actually pull the toe up and then curve it, or you can just pull it up and just get a little bit of curving, those kind of things. The big issue with hammer toes is pain. If it doesn't hurt, we don't recommend that you treat it. And the pain that you're going to get is you can either get rubbing on the shoes, on the top of the shoes, you can get calluses or soreness to the tip, you can get injury to the toenail, or you can get pain in the joints themselves. You can get pretty significant arthritis in that area, and that can actually be a bigger deal, a bigger problem. So if you have contracture of the digits, if you have hammer toes, if you have issues that way where the toes are curving and they don't have any pain, we don't recommend that you treat it. If they are having pain, then there's a stepwise process you can go through to treat these. One is you can say, okay, what can I do to pad it or splint it? There are splints that will pull the toe down, and if there's not significant arthritis and the toe does still straighten, meaning it's flexible, then a lot of those splints can actually take away your symptoms, and that may be sufficient for now. Orthotics are another option. Semi-custom or custom orthotics, where you put something an insert in the shoes that changes the way you walk, and if you put the right padding on those metatarsal pads or so forth, you can actually push the metatarsals up, and that will also a lot of times straighten the hammer toes, make them less symptomatic, less of a problem. But oftentimes, if it's sore enough, you may get to the point where you have to do surgery. And surgery is a good option for painful hammer toes, and it is everything from certain skin procedures. You can do certain types of tendon procedures, even sometimes just as simple as lengthening a tendon or cutting a tendon. It can be fusion of joints. We call it an arthrodesis, where you're actually the contracted joint, you straighten it, take a little bit of bone out on each side, and then fuse it so it stays straight. A lot of times at the second toe, that's what going to be required. Or you can do an arthroplasty, which is basically just taking a portion of that joint out and letting it straighten out because it's no longer contracted because the toe is slightly shorter. Basically, there are treatments, there are options you can do if you have a hammer toe. This is Dr. Brandt Gibson, and this is your Podiatry Tips Day 358, hammer toes. And truthfully, if you're having issues with hammer toes, you're saying, oh, they're starting to bother me, starting to be problems, I recommend you go in and be seen by somebody that can actually give you the options of treatment. If you'd like to reach out to us, you can go to utahfootdoc.com, and we'd love to see and help you get back functional, keep you functional, allow you to do the things that you want to do even with hammer toes. Thank you. Have a great rest of your night.